Bismillahirrahmanirrahim. This is the fifth and last news from today's newspaper, front page Dawn. COVID vaccine administration cells planned across country by Ikram Junaidi. Islamabad, while the federal government on Thursday decided to establish COVID-19 vaccine administration cells across the country, pharmaceutical companies suggested that licenses should be issued for local manufacturing of the vaccine as it may take years to import jabs for the entire population of Pakistan. Meanwhile, 2,475 new COVID-19 cases and 8 deaths were reported in a single day as the total number of active cases reached 34,537 in the country. According to a statement issued by the National Command and Control Center, NCOC, a special session on the vaccine availability and efficient administration was held on Thursday to mull over national vaccine strategy. The meeting was attended by Special Assistant to the Prime Minister, SAPM, on Health, Dr. Faisal Sultan, Federal Minister for Economic Affairs Division, Khusro Bakhtiar, Special Assistant Prime Minister, SAPM, on Poverty Elevation, and Dr. Sania Nishtar, Chairman of the National Disaster Management Authority, Lieutenant General Akhtar Tawasati, Surgeon General of Pakistan Army, Lieutenant General Nigar Johar, and Director General Military Operation, DGMO, Major General Naman Zakaria. Advisor to the Prime Minister, PM, on Commerce and Investment, Abdul Razak Dawood, joined the session via video link. National Coordinator of National Command and Control, NCOC, General Hamoud Zaman Khan, updated the forum on the national vaccine strategy. National Command and Control, NCOC, Director General Major General Asif Goraya said efforts would be made to facilitate the provinces for smooth vaccine administration. The meeting was told that as per the strategy, frontline healthcare workers, FLHW, would be vaccinated in the first stage of inoculation process of COVID-19, followed by people above 65 years of age due to their high vulnerability to the virus. During the second stage of the immunization process, all healthcare workers and people between 60 and 64 years of age would be administered the vaccine. The forum was told that it was expected that at the end of first quarter of next year, all frontline healthcare workers, FLHCWs, would be vaccinated. It was told that vaccine administration cells would be set up at all district and tehsil headquarters, hospitals, and regional health centers to ensure grassroots level approach of the vaccination process. On the other hand, the Executive Director of Pharma Bureau, Aisha Tammy Huck, told the Dawn that so far only 4 pharmaceutical companies had announced that their vaccines were effective. Pakistan is not a country having a population of 10 million people, So we need to go for the licenses to start manufacturing of vaccine, because otherwise it may take years to get the vaccine due to its unavailability and the high demand. Pakistan is quite capable and skilled to manufacture vaccine within the country. We will just have to get the license from the multinational pharmaceutical company and to start manufacturing under its formula, she said. Ms. Huq said India was going to produce 300 million doses of vaccine and claimed that Pakistan could also do the same. I don't think that vaccine will be easily available in international market. Pakistan should have booked vaccine long ago, like other countries. Now we may get Chinese vaccine only, and it may take a few years to get vaccine from other countries. So we should go for licensing to start manufacturing, she suggested. Chairman of Pakistan Pharmaceutical Manufacturers Association, Taqir Haq, said Chinese and Russian vaccines might become available by March. The private sector should be allowed to import vaccine as it will reduce the burden on the government. The government would be providing a free of cost vaccine, but the private sector will sell it, he said. Mr. Thaqib said the Drug Regulatory Authority of Pakistan should grant approval on fast track as top 15 companies of Pakistan were capable of importing, storing, and distributing the vaccine. 154 doctors die of virus. Meanwhile, the Pakistan Medical Association (PMA) in a statement said increasing burden of COVID-19 on the medical community during the second wave of the pandemic was proving to be more fatal for doctors. Till now, 154 doctors have lost their lives due to COVID-19 in Pakistan. During the second wave, which started from November, 45 doctors have lost their lives, 16 in Punjab, 14 in Sindh, 13 in Khyber Pakhtunkhwa, and 2 in Azad, Jammu and Kashmir. Pakistan Medical Association. PMA Secretary General Dr. Qasas Sajjad said the government seemed to be very careless about the welfare of the families of the deceased doctors. It has announced Shahada package for these families, but has not implemented it. And in the end, the formal request, if you have not yet, please subscribe our channel and press the bell button to get the fresh from us. Thank you for watching. Have a nice time and goodbye.